Hi, my name is Scott. So we're going to talk about some rotator cuff exercises that you can do post-surgery. Again, you want to avoid any active movement of your shoulder during all of these. And if any of them cause you pain, please let your doctor or therapist know and we can kind of modify it for you. So the first one is called the pendulum. This is Hannah. She's going to help demonstrate all these exercises. So the first one is called the pendulum. What she's going to do is she's going to bend over. And remember, no active movement. That arm has to be completely relaxed. Okay, she just lets gravity take a hold of the arm and just let it hang there. This is going to help stretch everything up in here, get a nice gentle stretch. So she's just hanging out right here. So go ahead and give it a shot. And from the looks of it, it looks like she's nice and relaxed. What I could do, actually, if I wanted to test, I just gently kind of move her hand back and forth myself while she's not doing anything. And you'll notice her arm is relaxed as it kind of wiggles back and forth, just like that. Side to side. And then when she starts getting good at it, what she could do is she could kind of stagger her feet and kind of lean into the legs, just like this. And then when she stops moving, that arm should stay swinging. It's not easy to do. It takes practice, but you want to avoid doing this on your own, okay? Because that is active movement and we could re-damage the surgery. So the next exercise she's going to be doing is going to be called a scap retraction. Scapular is your shoulder blade right up in here. And retraction is where we're going to be squeezing our shoulder blades together in the back. So what I can do is I cue her. These are her shoulder blades right here. I tell her to squeeze right here. She's going to go straight back with her shoulders. Now this is good because we're working on building the stability through the shoulder blade and making sure that we don't lose any of the muscle control right here. And again, she's not doing any active movement of her shoulder. This is her shoulder blade doing the movement. So with this, she's going to do 5-second holds 10 times. So the next two exercises we're going to be going over are stretches for your neck to relieve some of the muscle tightness that you're going to get from being in your sling. So the first one is called an upper trap stretch. Upper trap runs down here along the top of the neck. And what's going to happen is I'm going to ask her to bring her left ear to her left shoulder. She should feel a very nice stretch up in here. Remember, a gentle stretch. You don't want to force anything. You want to make sure that shoulder doesn't hike up, so go ahead and hike your shoulder up. You want to avoid any of this because that's just going to reinforce that tightness in your neck. So you want to make sure you keep that shoulder down, ear to shoulder. You're going to be doing this 5-second holds 10 times. And then if she'd like, she could do both shoulders as well. So the next exercise we're going to do is called the chin tuck. It's also known as a cervical retraction. And a good cue to do this one is I'm going to ask her to give herself a double chin. It sounds funny, but what she does is she brings the chin straight backwards rather than looking up or down. So come on over to the side and I'll show you. That's perfect. Her chin is going straight backwards, no up or down movement. And what this does is it promotes proper posture through her neck. It takes some stress off the muscles in her neck. And what happens is when we have poor posture, so go ahead and protract. What happens is we're giving a lot of stress up in here on these muscles, as well as the ones down here. And what happens is the shoulders tend to roll forward when we do this too, to kind of compensate. Now, those scapular squeezes help roll the shoulders back, and the chin tucks, go ahead and do the chin tuck, kind of fixes that posture up in here to give reliefs to some of these neck muscles and to avoid any anterior shoulder pain that you're getting. So the next stretch we're going to be doing is called a levator stretch, a levator scapula. It's a muscle that runs from the back of your neck and it attaches to the top of your shoulder blade. Now this one is also responsible for shoulder hiking, and both of those muscles, the upper trap and the levator scap, are going to be tight when you're in that sling. So a good relief stretch is she's going to turn her head very slightly to the opposite side and she looks down to that pocket, keeping that shoulder down. You never want to hike it up while you're doing these. She should feel a nice gentle pull, keyword gentle, all up in the back of her neck, side back of her neck. So she'll be doing this 5-second holds 10 times as well. And then if she wants to do it on the other side, she is more than willing. So the next exercise she's going to be doing is for elbow range of motion. Being in that sling is going to make your elbow feel very tight because you're going to be in it 23 hours a day on 7 days a week. So a good thing to do when we get you out of that sling in therapy is to straighten out the arm, use your other hand, and kind of assist that elbow to bend up and down, nice and slow. This maintains the range of motion you have in your elbow and prevents any tightness that you may start to feel. She's going to be doing this 2 sets of 10. Looks good. So the next exercise she'll be doing is for the wrist. This maintains your wrist range of motion because we don't want you to lose any motion from the shoulder. So all she has to do, it's like riding a motorcycle. She's going to go up and down with her wrist, nice and slow. She's going to be doing this 20 times. And then when she is done with 20, she's going to be going side to side with her wrist, as so. So another good exercise that you could do to maintain your grip strength is you take a towel or a stress ball. And what I'm going to ask her to do, she's going to be holding onto that, and she just squeezes that towel as hard as she can without pain going up at all in the arm. She's going to squeeze it for 10-second holds 10 times. So being in a position like this with the sling off can be an uncomfortable position, especially immediately after surgery, which again, you are not supposed to be doing. However, what you can do is you can take a pillow, and you need someone to assist you because there's no active movement, or she could take the other hand and help her. She lifts that arm, places it on the pillow. This is going to provide proper support so that shoulder isn't hanging too far down and causing a lot of stress in that joint. So thank you for stopping by. We wish you the best of luck post-surgery, and make sure you are compliant with all of your orders per your doctor and therapist. If you have any difficulties or problems, please let us know and stop into the clinic. Thank you.